I'm a mechanical engineer, and I've got a few patents of my own. And with mechanical patents, you can get around them. There's always something you can do to redesign that patent. But with pharmaceutical patents, that doesn't happen because they're specifically written as to what chemical you use, what disease it affects.
So how does this pertain to your situation today?
Okay, because now you know what my thinking is. You're a psychiatrist, you know what my thinking is. And I talk to people about that, oh, you're cynical. Well, I don't know, you go home and evaluate that. But this is the medical profession today, that they're controlled by the pharmaceuticals who come in and tell them what is right, and they write, and it's a money circle. It's a big money circle, and the pharmaceuticals make billions of dollars. Now, I have a friend, I run in the community out here called Fleetlandia. I don't know if you know what that is or not, but it's a CCR, a continuing care retirement community, CCRC. I have a friend who was the chief pharmacist for the state of New York. And he used to testify against false drug use. They used to bring him under armed guard and to testify at a trial. So he knows a lot about it. He only had his own pharmacy, so he knows what the kind. And the pharmaceutical guys, when he got out of the drugstore business, they said, come and work for us. Well, then, what do you want me to do? He said, well, we got this new drug that we want you to go down and educate doctors on it. And you've got a prestige behind you, having been chief pharmaceutical director for the state of New York, and you'd be a good salesman for it.
So, with that background, now that I know
Oh,
where
no,
you're
wait a minute, you
coming
didn't let me
from,
finish the story, God damn it. Okay, can I finish? And so
I
anyway,
don't-
he didn't take
here's the thing. The thing is that we do need to come to a point so that I can figure out how best I can help you.
You need to come to a point where you can get me out so you can get another appreciation in here. Now, let me finish the story. So he didn't take the job.
All right.
Why? Because he talked to the pharmaceutical and they said, we sell this drug, and he said, how much do you charge for it? Well, it costs $100 for the patient. He said, I know it only costs you 3 cents to make that of chemicals. Oh, but you don't understand. We had research, and we had blah, 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 and we had selling costs, and oh, it's been years, we've been working on this. He said, I'm not gonna go and tell doctors that they should recommend this thing to their patients for $100 when I know damn well it's not costing you 4 cents of material to make that. That's the end of the story.
So do you know how many doctors at Mayo Clinic talk to any of the people that you're referring to?
I have no idea.
0. Because Mayo Clinic has been one of the very few places which for a very, very long time.
And I'm not talking about the doctors at Mayo Clinic, because I'm a great believer in multidisciplinary medicine. I came from Youngstown, Ohio, and I went to the Cleveland Clinic, and I always said, there's nothing like multidisciplinary medicine. I had my medical services with Cleveland Clinic, who had a branch that they opened down in Punta Gorda, down in Naples, before I moved up here. So I moved where I had my open heart surgery up in Cleveland, down to Cleveland Clinic. And when I moved up here, I moved to a multidisciplinary medicine here, Mayo. And it turns out that Dr. Stan Campiano was a personal friend of my doctor down at the Cleveland Clinic, and they had visited each other since college days. Isn't that a coincidence?
It's just, world is a small place sometimes. Well, I appreciate that you were here. Now, here's the thing, though. I totally respect your thought process and where you're coming from. I think there's a lot of validity to it as to at least how it used to be. Things obviously have started to change, but I understand perfectly what you're saying, and there's some good points there. Coming back to how it is that what is it that we can do to make sure that we are in a position to be of best help to you as an individual patient of ours. I have a great respect and admiration for Dr. Graf Radford, and he's the one who can eventually make the determination whether you can and cannot drive, and to do that, he would need to get the imaging studies done. But I will also respect if you don't want to get that done. That's ultimately your choice. I can't force you to do that. All I can tell you is that in not only a professional opinion, but if I was advising a family member that I really kind of liked and wanted to help them, I would strongly encourage them to get that test done because it can clarify some of the questions that you have and you're wondering as to why is it that all these doctors don't want to sign the papers for me to drive. After all, it's just a simple matter of just letting me drive when I'm functioning fairly well. And I can perfectly understand where you're coming from, because the challenge is that if there are certain parts of your brain, if they are not working very well, they make a person very impulsive, where they end up doing things that they won't do otherwise, where they are unable to think through the gravity of the decisions that they're making and its impact on them and on their loved ones. And then they remain frustrated. You're a smart guy. At some level, I know that people know that something just isn't right, and they are trying to make things happen so that it works out okay.
No, you don't know that.
Well, you know, what it is that I'm just sort of saying that based on our clinical experiences, we recommend that you get that test done so that Dr. Bradford can come to a conclusion if your brain function is fine or not. If you don't want to do that, that's perfectly fine. That's your decision and you get to make.
That's why I'm here today. I said I would come to this appointment today. If it didn't involve any x-rays, if it didn't involve any drugs, I'll talk to anybody all day long.
Correct. So, I mean, the only way that I can help you out is by recommending some medications which obviously you don't want to take. But there are medications that can help you get sort of better focused and better organized in terms of what you're thinking. If you don't think there is any need for that, then I don't think there's anything that I can help you with.
Okay,
All right?
okay.
But I would strongly recommend that you consider at least getting that workout.
I strongly considered it. I considered it, and I've decided that I don't want x-rays applied to my brain, and I don't want to take drugs that I don't know anything about.
All right.
Why? Because I don't have any problems.
Sounds very good. We'll have to agree to disagree on that, but as I said, I
We
totally
can agree to disagree on that.
Exactly.
Right.
All right. Well, I wish you the very best of luck. I sincerely hope that things work out okay for you.
Thank you very much.
Good luck, sir.
Good luck.
So
Good meeting you.
clinically